Hello everyone, and thank you for joining me again tonight. I hope you've all had a good day. I'm really excited for this live tonight, and I'm thrilled that a number of you will be able to join me as I talk with one of Melbourne's most renowned physiotherapists in the area of women's health. And when I was thinking about where to sort of go with my next few lives, I decided that a great area to focus on would be preparing for pregnancy. And over the coming sort of weeks and months, I'm going to be sharing with you all of my tips for preparing for pregnancy. Pregnancy is a time of immense and incredible physical change, and getting your body as ready as possible for that time is something that's really critical to achieving the best outcome for both you and your baby. And I thought that there was no better place to start than with Shira tonight. Shira is a physiotherapist and a leading pregnancy fitness and exercise expert. She is the owner and director of Be Active Physio in Melbourne. I've sent a huge number of my patients there, and they all rave about the care they get there. So I'm just going to get Shira on the line, and we'll get started shortly. Hi Shira, how are you? Hello? I'm good, Shira. Thank you so much for joining me tonight.
Ex-
Hello?
yes, are we there?
Excellent. I'm really
Yeah.
excited about our live tonight, and I've had a huge number of questions directed sort of at this particular topic. So I thought it would be a really great place for us to start. We've done many presentations and talks together before, with the focus being on preparing for pregnancy. And as I say, I think there are so many physical changes that occur during a pregnancy that getting your body as ready as possible is such an important thing. And I think we're really lucky to have you here tonight to tell us all about the best way for us to do that.
Thank you. Happy to be here. I'm as passionate as you are about this topic,
Excellent.
so
So
it's going to be.
I know I've heard you talk before, and you do such a good job of it. So I thought you'd be the best person to guide us through this evening. So Shira, I know from the talks that we've done together before, you talk about sort of preparing for pregnancy as being broken down to a number of different sort of elements. You talk about preparing your fitness and strength, preparing your pelvic floor, preparing your posture, preparing your core, and preparing your mindset. And I thought that what we could do tonight is go through each of those in turn, just to give the people watching a bit of an idea about how we can address each of them, if that works for you. Hello? Excellent, fantastic. So Shira, essentially, before we break it down into each of those, I think maybe your connection's not great there at the moment.
Okay, we'll see how we go. Otherwise, I'll relocate.
Excellent. Sounds good. So, Shira, essentially, I thought it'd be just good to start with why it's so important for a woman to optimize physical fitness and well-being prior to pregnancy. As I said, obviously there are a lot of changes that occur during pregnancy, but can you just sort of summarize them for us so that women know what it is that we're actually aiming to achieve by getting ready before pregnancy even occurs?
A marathon. I'm a keen runner, and I like to sort of view it as preparing for a marathon. So if you go to a marathon, it's about 4 hours. If you turn up to the start line of a marathon and you're not physically fit, you've got some ankle niggles or knee issues, you're probably going to get through the event. But so you're probably going to get through the event, but you're going to struggle. It's going to be hard work. Whereas if you're well trained, you've sorted out your issues, you're going to enjoy that ride a little bit more, or maybe not, but at least you're going to get through it a bit more comfortably. Similar to pregnancy. So pregnancy, it's not 4 hours, it's about 40 weeks. And the changes during pregnancy are massive. So as you know, Scott, physiologically, huge changes. They occur quickly as well. Within the first 8 weeks, respiratory changes, cardiovascular changes.
Yes.
your body changes as well. You know, within 20 weeks, which is not a long time, you've got a lot more to carry. So obviously the weight of the baby, the weight of, you know, got more blood volume, the boobs get bigger. It's hard work to carry that load. Now, if you start off your pregnancy with some niggles, so some back pain, some neck pain, some pelvic floor issues, if you're not physically fit and strong, that journey of pregnancy is going to be far more of a struggle for you, and you're going to perhaps not enjoy that beautiful and really special time of your life as much as you would if you were started off a start line a lot better. And Scott, it's really interesting because over the last 10, 15 years that I've run Be Active, I've seen a massive change in when women are actually taking that first step to look after themselves. And if I rewind to the early days of, you know, 10 years ago, it was very rare that a woman would come to see us at Be Active to say, look, I'm planning a pregnancy. I want to be proactive. I want to, didn't happen. If I go sort of 5 years ago, they were coming in their first trimester potentially. They were starting to get a bit more proactive. And in the last sort of year or two, and I think much of that's to do with your work and your, you know, flying that flag of let's be proactive, let's get you looked after. We've had a lot of women, a lot of your patients who are coming in before they're actually, you know, they're just in that contemplation state of potentially I'm going to have a baby soon. It might be a good time to get myself looked at, sort out that back pain, get myself physically fit, and so on. And my experience is that these women are, you know, that they certainly have a better journey through pregnancy and recovery. So, yeah, I think it's really important.
And I absolutely, I echo everything you're saying. And I see the same with all the patients that I send to you, the ones that are prepared, their physical health is optimized. They really struggle less with the physical demand of pregnancy, and they seem to have a much smoother ride. So that's the reason for which I send them early, and it seems to have great results. So thank you for supporting them through that. So what I thought we could start by doing is talking about the first point that you always talk about, and that's preparing your fitness and your strength. So what should a woman be doing prior to pregnancy to optimize her fitness and her strength?
Yeah, so I think it's really important that we look at cardiovascular fitness because of all the changes to your cardiovascular system, your fitness. So finding something that's going to raise your heart rate up, but to a safe level as well. So we're looking at doing, so if we look at the guidelines by ACOG, we're looking at doing some exercise on most days of the week, about 30 minutes a day or 150 minutes per week is. Things that pre-preparate in the pregnancy, pregnancy time is low impact options. So things like cycling or spin, walking, swimming, rowers, those kind of low impact options that are not going to put strain on your pelvic floor, your pelvic joints, and that you're going to get your heart rate up and your fitness up to a good. Also really cardiovascular fitness up, but that you're actually physically strong. So if you go to a pregnancy, once you're pregnant, you go to childbirth education, they often put those heavy vests that mimic a pregnancy on the partners, so they know what pregnancy feels like, and it's a heavy loaded vest, and it's heavy, and you need to wear that for entire pregnancy. But these people who get up there, they struggle for a few minutes, and that's just sort of to give you a bit of an idea of it. You know, it is hard work, it's heavy, there's a lot to carry. So the stronger your body is to withstand that, the better you're going to be. So we really need to focus on some strength work. The main areas to focus on is like your quads. So you've got like doing things like squats, your glutes, upper body.
Shira, sorry to interrupt, but I think you keep cutting out. Are you able to move somewhere? Thank you.
Okay.
Sorry
Internet
about this.
should be a little bit better, hopefully. Okay. All right. Thanks for your patience. Let's try
Fantastic.
that. Okay. Okay. Hopefully that's better.
Seems more promising already. I'll keep you posted.
Okay. Cool.
Excellent. Brilliant. Perfect. Thank you for the tour of your house. Much appreciated. So you talk about doing exercise that sort of gets your heart rate up a little bit. Is it all myth that your heart rate shouldn't get up to sort of beyond a certain point early in pregnancy, or is heart rate not as important as other things like sort of your ability to tolerate different degrees of exercise in pregnancy?
Yeah, so that's a great question. So they used to say, 140 beats per minute was what you need to keep your heart rate up, and that's what a lot of pregnant women would go by. They'd wear the heart rate watch. What they found is that a very conditioned person versus an unfit woman, they're working at completely different intensities to get to the 140 beats per minute. Their core temperature and consequently the effect of core temperature on the baby. The baby's temperature is significantly different. So that's not what we go by now. What we're looking at is the rate of perceived exertion. So you should be able to comfortably talk through the exercise. So intensity-wise, it's talking, not singing. So you should have a conversation, or a scale of 0 to 20, 20 being a really hard workout. It's 12 to 13. So it's kind of, it's more self-monitored. Yeah.
Brilliant. Excellent. I know a lot of women sort of come and they say, when I'm exercising prior to or early in pregnancy, how high can my heart rate go? But I sort of share what you're saying as well. And what I've learned from you is that it's more about the intensity of the exercise and ability to talk through it. So
and just another point on that is also the duration. Yeah, the other point on that is intensity, but also duration. So after about 30 minutes, some of the studies are showing that there's a peak in the core temperature of the baby as well. So it's one is duration, as two is so intensity and duration. So keeping your cardio to about 30 minutes maximum.
Perfect. Excellent. So let's move on to the next point of yours, which is preparing your pelvic floor. I think this is a critical one as an obstetrician, and I see a lot of women many years down the track who've got issues with the pelvic floor that potentially could have been reduced if there was more sort of work put into it prior to and during pregnancy. Can you explain for the people watching tonight what actually is the pelvic floor and what happens to it during pregnancy?
Sure. So I left my pelvis in the other room. I had a little model of what it was, but that's okay.
Sorry,
essentially your pelvis is it's a group of muscles, ligaments, blood vessels, fascia, so at the base of your pelvis. So your pelvis is really where your hips are. It's like a bowl. It's a really important structure. So you've got muscles, fascia that essentially hold everything up. So it holds up your organs, bowel, bladder, uterus. It stops your organs from descending down. It also controls when and where you go to the toilet. So your ability to hold, wind and wee. So kind of important bodily functions, really important. The effects of pregnancy on that area, so on that muscle, on that fascia are significant, as well as childbirth and so on. So we really need to get that sorted. But the thing with the pelvic floor is it's completely taboo. So thank you for bringing up the topic. It's one of those things that we know 1 in 3 women during pregnancy are going to have issues. 50% of women after delivery at some stage are going to have issues with controlling that area, but it's often not talked about. So I love that we're talking about this live tonight, and just getting that message out that you really need to get on top of it, be proactive, get that area strong. If you've got issues, that you actually seek help and get it sorted out sooner rather than later, because there's a lot you can do to prevent and manage it.
Absolutely. And as an obstetrician, I think what I get sort of asked a lot by patients is whether or not, a vaginal delivery is much worse than a cesarean section, for example, for the pelvic floor. But what I think a lot of women don't realise is that pregnancy itself is actually the greatest risk factor, essentially, for pelvic floor damage. So regardless of what's happening with your birth and delivery, you're still at risk of having issues with your pelvic floor. So even for women who say, I'm going to be having a cesarean section for whatever the reason might be, it doesn't mean that they're immune to issues with the pelvic floor. And all pregnant women really need to focus on pelvic floor strengthening. Is that something that you would endorse?
Yeah, absolutely. So it's the 40 weeks of carrying the load of the baby. It's the relaxin hormones that cause that area to relax. So we certainly need to make sure that that pelvic floor is optimizing effectively. And like every muscle, you need to strengthen it. And sometimes if they're too tight or hypertonic, then they need to be released. So we need to work out, is it a weakness issue? Is it an overactive issue? So I think proper assessment and getting the right exercise is important. Yeah, absolutely.
Great, Shira. So for people watching tonight who are planning a pregnancy at some point in the near future, what should they be doing now to strengthen their pelvic floor? What examples of exercises can you give that they might find achievable and useful?
Yeah. So you want me to talk you through it? Fantastic.
That'd be great.
So
Yes, please.
talk you through an exercise. I think the first thing is, though, if you are having any symptoms at all, so your inability to control wind or wee, so you can't hold on to your bladder, a few drops or complete loss of urine, then you need to get yourself sorted out. If you have any symptoms of prolapse, which is like a heaviness feeling, again, get that sorted out, get it assessed, get it checked. And anything bowel or bladder related that's just not normal for you, that you sort of get onto it. So pelvic floor exercises aren't the answer to everything. You need obviously proper assessment, but I'll give you an overview just to get you familiar with that area. It's really important. Yeah, really a good investment. So let's start in that on, you need to sit up nice and tall. Scott, are you doing it with us too?
Perfect. I will.
Okay. Now this it's kind of like a secret exercise. No one should actually see you doing it. If you're doing it properly. So it's all internal. So I'll get you to sit up nice and tall, relax the area around your pelvis. So imagine the area you're sitting on, that's your perineum. I want you to let that all go. So imagine like you're releasing wind and wee. So you're letting go of a fart and wee. Has Instagram got any things that we need to avoid? No, it's all good. So let it all go. Yeah, so you're nice and relaxed down there. And then I want you to tighten around the back. So as if you're holding wind. Front as if you're holding wee. So it's wind and wee, but it's not clenching your butt cheeks. So back and front, and it's a lift up inside. What you don't want to be doing is squeezing your butt cheeks, holding your breath, lifting your eyebrows, clenching everything else. There's a few good analogies that you can think about, like lift doors that are closing back and front. You're lifting up all the way to like the 10th floor and then back down to the ground, but we're not pushing to the basement. The straw analogy, which people generally love in our classes, is like a strawberry milkshake. You're lifting the liquid up the straw, high as you can. Release. Yeah, there's plenty of others. We could go on all night, but I think you get the gist. It's a lift.
Absolutely.
Yeah.
Brilliant. And I think those are very, very useful analogies. How often should women be doing the pelvic floor exercises? And ideally, sort of how long before they're trying to get pregnant should they start doing these things?
Yeah. They should really, I mean, I'd love to get this out to schools where adolescent girls are starting to do it then. So it's never too early. I think any female really should start to do them. My prep boy knows where his pelvic floor is, so it's never too early. So start doing them early. You need to be doing them about 3 times a day. But I don't love giving a prescription of how long. I think it needs to be individual, but generally speaking, it's kind of part of your daily routine, 3 times a day, where you do 1 endurance hold where you lift as long as you can, and then you're doing about 5 or 10 quick lifts and releases.
Brilliant. Fantastic. And for a woman who comes to see you prior to pregnancy for sort of a pelvic floor assessment, so that you can tailor a program to her, what does that assessment involve as a physio? What would you be doing for her?
So there's different ways of assessing it depending on the comfort and what issues are presented with. But there's ultrasound, real-time ultrasound, which is just a surface probe that goes on your lower abdomen. On a screen, you get to see your bladder. And as the physio, we get feedback. You get the feedback of your bladder lifting and lowering. That gives us a roundabout idea of, are you on the right track? Are you lifting it? What's your endurance like? Can you hold it? And it's a good way for you to get that feedback. That's one way. The other way is an internal or digital assessment by a physio who's trained in doing that with experience, where it's a digital examination. It is gentle, fingers are inserted, and it's more of the gold standard where the squeeze component of that muscle is also assessed, not just the lift with the ultrasound. So either of those two options,
Fantastic. Brilliant, Shira. So I'm going to move on now to number 3 of your 5 sort of tips, preparing your posture. So we've spoken a bit about sort of the changes that pregnancy results in, but what actual physical changes during the pregnancy lead to posture being affected? Obviously, there's a huge belly in most women by sort of 40 weeks, made up of baby, placenta, amniotic fluid, but what sort of changes physically impact upon a woman's posture in pregnancy?
Yeah, so if we start at the feet, so the
Yep.
arches of your feet, essentially they bear a lot of weight.
Hmm.
They sort of offload weight. Every time you step, the arches of your feet are really important to dissipate that weight. In
Yep.
pregnancy, the arches of the feet tend to flatten because of the relaxin hormone. So the
Yes.
flattening of the feet, the knees tend to start to lock out. The pelvis, really important. The pelvis, so that bowl I was talking about before, where your pelvic floor is, because of the center of gravity change, that pelvis starts to tilt forward, which can then
Hmm.
lead to things like lower back pain.
Hmm.
Because the boobs are growing, chest is heavier, often we get rounded in the upper back, and then the
Yep.
neck comes forward.
Hmm.
So really from the ground to up, there's a lot of changes biomechanically and anatomically that are happening.
Definitely. And I
Yeah.
mean, I see probably, I don't know, maybe up to 50% of my patients reporting back pain late in pregnancy, in the third trimester particularly. And I suspect a lot of that relates to the postural changes that occur as well.
Yeah.
Do you find that preparing your posture really helps to reduce the incidence of sort of significant back pain in pregnancy?
Yeah, absolutely. So one is an awareness piece of like being aware of how you is ideal to hold yourself, and two is
Yeah.
just strengthening the body so that you can actually hold those positions and counteract that increased weight. So yeah, absolutely.
Absolutely. So if we focus on preparing your posture for pregnancy, what sort of exercises should women be doing to optimize this area?
Yeah, so I think first is to make sure that, and there's a lot of people working at home now and we've had a lot of pregnant women who are working at home and they've got enormous issues with lower back, upper back, pelvic girdle because of
Absolutely.
their chairs and things. So I think making sure that
Yes.
your chair that you're working from or sitting on at home, your
Hmm.
car seat, your office chair is all sort of good. But
Hmm.
preparing your muscles, ideally you're working a lot of upper back work, so things like rows, you can
Hmm.
use TheraBand, pulleys, that kind of thing. So upper back
Yep.
strengthening. As I said before, squats, lots of quads work, and we do heaps of those in our pregnancy classes. The stronger you get your thighs, the more you're able to counterbalance that growing belly, and the less waddle you're going to get through pregnancy. Strong glutes, so the glutes are a major support system for your back and pelvis, so making sure they're
Hmm.
strong with things like clams, and then and getting your core, which I think we'll talk about a bit later. So they're sort of the main ones. And I think whatever your weak point is, so
Absolutely.
if you've got a weakness, that tends to be amplified in pregnancy. So if it's weak wrists or weak whatever it is, strengthen
Yep.
those in the lead up, definitely. Yeah.
Great. Excellent. Well, you just briefly spoke about preparing your core a second ago, and I'm going to move you onto it now, if that's okay. I think a lot of people use the word core a lot, but don't actually know what the core is. What do you refer to as the core, and why does it need to be focused on prior to pregnancy?
Yeah. So this is really important because this is the real, it can lead to a lot of issues further down the track. So I think this is like a key component in preparation for pregnancy. And if you are pregnant, that you are prioritizing this area. But essentially the core, um, the myth with the core is that it's your outer abs, it's your six-pack muscle. You need to do planks, ab curls, get your outer abs strong. So that is actually not, yes, we need to work our abdominals in preparation for pregnancy, but they're not the right ones. We need to focus
Yep.
on the deep ones. So your core
Yep.
essentially is the base of your body in which your limbs are working on, and it's the floor of the, if you think about a cylinder, so bottom, top, front, and back. The floor of your core is your pelvic floor, so that's the
Hmm.
base. The top is your diaphragm, your breathing muscle. The front is your deep abdominals, so your transverses, which is your deep core, not your outer
Hmm.
ones that you
Hmm.
see, but it's the deep ones. And then your deep back muscles at the back. So you've got diaphragm, pelvic floor, deep abs, and your deep spinal muscles. So all those components need to work together. It's not
Hmm.
just a matter of working these outer abs.
Absolutely. And what's the primary aim of strengthening your core? What does that help with during pregnancy primarily?
So that's going to prevent back pain, which, as you said before, is quite common. It's like 80,
Hmm.
90% of pregnant women will
Mm.
have that. So a strong core is going to prevent back pain. It's going to assist your posture so that you can
Hmm.
counteract the postural changes. It's going to prevent abdominal muscle separation, which is where the front, that outer abdominal, the rectus abdominal separates at the front. So the stronger the deep ones are, the less that is likely to happen, and which leads to back pain, hernias, and just pelvic girdle issues.
Absolutely.
So
a lot of my patients are really really anxious about developing DRAM, or divarication of their recti. And what sort of exercises can they do to prevent that from happening?
So I would urge anyone who is planning a pregnancy that they stop doing any outer global abdominal work. We find that the stronger the outside, or like the six-pack muscle is in the lead up to pregnancy, the more likely it is to separate. So if you can change your focus to working deeper abdominals rather than the outside, that's a good start.
Definitely. I think that goes against what a lot of women actually think, to be honest with you.
Yeah, and we get a lot of like fitness instructors, personal trainers in who have spent their whole sort of life working these outer abs, and they've looked fabulous, but unfortunately it's been a detriment during pregnancy. So
definitely. So what exercises would you recommend therein that actually protect against that sort of stuff from happening?
So it's going to be, this is, it's hard to talk it through, but if you can think about, if you can take your hand to your lower abdomen, like below your belly button, sit up tall. So I trust you're doing it, but so your lower abdomen, sit up tall, and then you're gently drawing the muscles away from your hand. So it's low down, it's a gentle pull in, that's the base. It works with your pelvic floor, and hold and breathe. That's sort of the foundation of that exercise, where you're pulling in lightly. So that's kind of the basis. And then you can do things like sitting on a fit ball or a Swiss ball and doing some gentle leg movements. Things like on all fours, hands and knees, lifting an arm up, a leg back. Clinical Pilates, like on the reformers, can be a good way. So there's different ways you can work these muscles, but it's about quality. So making sure you're switching them on properly. So at Be Active, we do real-time ultrasound for that area. So if you are coming in for pre-pregnancy, we would scan that, show you where your core is, make sure that you're switching it on well, and then we would progress you to things like on the ball or on the reformer.
Brilliant.
And preparing it,
Fantastic.
The thing with the core ones is they're quite slow, which is where I think it's much easier to do a plank for a minute or do 100 ab curls, because you don't need to think much about it. You're just doing the movement. So these are more mindful movements, making sure that you're switching on properly. They're slower. They're more endurance-based.
Excellent. Brilliant. Fantastic. Moving on to your fifth point, which is preparing your mindset. I think this one is absolutely critical, and I think that a lot of people under-recognise the importance of this one. But why do you as a physio consider it so important, and what tips do you have for allowing women to healthily prepare their mindset for pregnancy?
Yeah, so I think I tend to see women who are in sort of two schools. They're not an exerciser. They don't like exercising. They don't want to do it. So I think from that point of view, I spend a lot of my time in kind of coaching women to find something that they enjoy, talk about the benefits of what doing it. So I think that if you're not an exerciser, I think you need to take on board what Scott and I have discussed into the importance of it, and just finding a way to start moving on a regular basis, not just, and we know that women who exercise in pregnancy are more likely to be exercising further along, throughout their whole life cycle, the whole life. So I think it's really important to start that habit now if you haven't done it before. And then there's those who are the exercise lovers. They love running, they love going to the gym, they love doing a lot. So for them, it's often, and if that's you, I understand you, I'm one of them. There's a runner behind me. I do love running, but when I was pregnant, definitely a time to tone it down. So you've got your whole life to do that. And I think just having a mindset that pregnancy is such a special time. It's so important that you enjoy it, that you're healthy, that you're safe, that your baby is in the best optimal environment as well. So just having the mindset that what you're doing now is not forever. You might need to tone down your exercise or change it from high impact, high intensity to low impact type stuff. But just know that it's only for a short amount of time in your life, and it's going to mean that you can get back to doing the things you love faster. It's not going to hamper your recovery.
Definitely. And
Yeah,
something
and I
I'd
think
love,
that, yeah,
yes, I was
yeah,
going to say
sorry,
something
yeah.
I'd love your opinion on as a physio. I think a lot of women over the past few months, given everything that's happened with COVID-19, for a lot of people, it's meant they haven't been able to do their regular exercise and they're feeling a bit deconditioned, really, a few months down the track. My question to you is, should women that haven't been doing as much as they previously had been for the last few months get straight back in at the same intensity they were previously, or should they back off a little bit and go a bit more slowly? What's your advice as a physio? Because that's something that I'm getting
Yeah.
asked by a lot of women at the moment.
So I think it's really important to get started, and I think more than the physical is the mental. It's always a way up between, yes, you've done nothing, you're deconditioned, to like
Yeah,
mental health. So I think
yeah,
it's really important to get women moving, but just doing it in a graduated way, doing it
yes,
ideally in a supervised way. I think all
yeah,
pregnant women should be pre-screened
mm-hmm,
by obstetrician, GP, or physio. Make sure that they're safe, make sure they're choosing the right options. But I would start with a gradual return.
mm-hmm,
Gradual return does not mean, okay, I haven't done anything, so I'm going to come once a week. I think consistency is really important so that they come doing it regularly, but not, we've certainly at Be Active eased people back in. We've had a lot of pregnant women with injuries because they've done a lot of these YouTube things at home, chosen to do kind
definitely.
of too much, or then there's others who have done nothing and they're feeling quite down and low, so we're trying to get them up. So, yeah.
Brilliant. Fantastic. Now, that also actually links in nicely with the next thing that I want to talk with you about, sort of in brief, and that is when you speak about sort of gradual return to exercise, it makes me think of postpartum return to, exercise. And I often get asked by women, when can I start going back to doing everything I was doing before I was pregnant, and how quickly can I return to my normal exercise? And I know that you have developed a brilliant postpartum fitness program called Restore Your Core. And I thought that even though we don't have time to talk, in great detail about postpartum recovery and fitness, I want to leave that for another time with you.
Yeah.
But if you could just touch on Restore Your Core and give us a bit of a summary about how women should, strengthen and condition themselves postpartum, what's sort of your take on that?
Yeah. Great. So I think we need to think about two things with postpartum and exercise. I think it's really important that we break it up in terms of recovery and
Mm-hmm.
rehab
Yeah,
to fitness. And often there's a bit of a
great.
blur between those things, but I think it's really important for all mums, whether it's Caesar, vaginal, whether it's a
Yeah,
fit triathlete or a complete decondition, that everyone goes through a rehab process because of pregnancy, the weight, the load on the pelvic floor, on the abdominals, and then
yeah,
vaginal birth and all those things, or cesarean, that we need to recover and rehabilitate. So
yeah,
all women need to start their pelvic floor and their deep abdominals within the first few days of delivery, and often that's done on the ward with a physio.
mm-hmm.
And we generally will have women at Be Active come to see us at 3 to 4 weeks postpartum to get that process going. What we
Great.
don't want to do, which is what I have seen over the years, is it's overwhelming. Motherhood is overwhelming. There's a lot of change that
Absolutely.
women wait, and they wait 3 months or 6 months. Or
Mm-hmm.
I had someone today who was 22 years postpartum with abdominal
Wow.
separation.
Yeah,
So whenever that is, that you do it as soon as possible, that rehab phase, the earlier you do it, the quicker it is. So if you do it within the first 6 weeks, it's
yeah,
going to just happen a lot quicker than if you do it 6 months down the track. So
great.
pelvic floor, deep abs, and just recovering those deep muscles within the first few days. My program goes for 8 weeks. So that's my
Mm-hmm.
experience. That generally is going to take 8 weeks for pelvic floor, deep abdominals, abdominal separation to recover.
Yeah,
If you do the exercises regularly, consistently, and do them with good
fantastic.
technique. So 8 weeks for that. Then you can return back to, if we look then towards, and doing your walking, your spin, like your low impact options can start at
Yeah,
about 6 weeks.
great.
If you're looking to do heavier, weights, 6 weeks, and just gradually increase your load, but you always want to be exercising for your weakest link. Generally, that's going to be pelvic floor,
Sure.
abs. So just making sure you're not doing too much too quickly. And then if you're looking at high impact exercise, so you're running, you're trampolining, horse riding, tennis, my recommendations are on the conservative side, but 4 to 6 months until your pelvic floor has recovered sufficiently. You've got enough strength to withstand that and once your abdominal muscles have closed over. So
Brilliant.
They're my general, but it needs individual assessment. Some can do it earlier.
Absolutely.
If you're really keen, for example, to get back to tennis, if
Yep.
you have a pelvic floor assessment, you can get more specific guidelines and potentially start earlier if it's all clear. So
Brilliant. And your Restore Your Core program is an 8-week online program, is that right?
Yeah, so 8-week online, you can start that within the first few days of delivery. So it starts very gradual and gentle. It's all restorative exercises, focusing on pelvic floor, deep abdominals, and all the postural and strength muscles you need for motherhood. So it starts at a low level, and then we work you up gradually over the 8 weeks so that you're ready
Brilliant.
then to hit the fitness arena after that. So
brilliant.
yes.
Excellent, Shira. Now, I know that the focus of our talk tonight was sort of preparing your body for pregnancy, but I've had a few questions which I'd really love to ask you if you've got a few more minutes, because
absolutely.
I can think of no better expert to answer them than you. So someone's asked tonight about pelvic girdle pain in pregnancy. I mean, the number of women I see with pelvic girdle pain is sort of is massive, and I think a lot of women have some degree of issues with their pelvis in pregnancy. So what actually is pelvic girdle pain? Which parts of the pelvis are affected? And what's the best way to manage it in pregnancy? I mean, when I see women that I believe have pelvic girdle pain, I send them to you, and that's sort of the treatment they're in. But what do you actually do with these women when they come to see you?
So pelvic girdle pain is essentially what the symptoms would be pain on the front, on the pubic bone, or in your buttocks, through your sacrum, either side of your buttocks. It can go also down your leg. I think initially, don't go to Google, get a proper assessment. Ideally, not by a general kind of physio. You want to see someone who's got experience in prenatal, because it is quite specific. So I think avoidance, essentially, you want to be avoiding, whether you've got pain or not, is any single leg standing in pregnancy, anything where your legs are wide, anything where you're going into like a lunge or a deep squat. You want to be avoiding that. So I like to talk about a mini skirt. You need to move in pregnancy like you're wearing a mini skirt. Don't take your legs out any further than that, unless you're having an assessment by Scott, I guess. But legs stay narrow, they stay together. Management with physio is going to be assessment of the joints, and then we do some release or like soft tissue release of whatever's tight. We often can use tape or belts to help stabilize you, give you specific exercises that are also going to help to stabilize you. It cannot be also correlated with abdominal separation. So if there's an abdominal separation, we get you in compression, we get you onto some abdominal exercises as well. So there's definitely a lot that can be done to manage it. So just make sure you get a good assessment and get yourself on track.
Brilliant. Excellent. We spoke, just moving on to the last question for tonight, about the effects of sort of a weak pelvic floor and the issues that they can cause throughout a woman's life. I've had a question from someone about the opposite. So essentially, for women who have a hyperactive pelvic floor, what issues can this cause in pregnancy, and particularly related to birth itself? What do you see as being the issues? Yeah,
so it is interesting because I feel like we probably get 50-50, weak versus strong pelvic floor. It's not necessarily a weakness, but symptoms that we tend to see is like pain, pain through the pelvis, the coccyx, the pubic symphysis. People can get like groin take pain. They may have no symptoms at all, but you do want to have that muscle being able to relax effectively during the birthing process. I don't need to tell you, Scott, but that muscle does need to relax. So it's really important that you have got that brain, that neural pathway of being able to actually let that go. So I think training on that relaxation, so that when you do get to delivery, that you can actually release it. But it does have a really important function to play also in your spinal health, in sexual health. So it's really important that that muscle can relax and contract effectively. So again, in physio, there's a lot of retraining that we can do to assist with that relaxation. There's different techniques that are used and hands-on treatment.
Brilliant, Shira. Well, I think based on everything you've sort of told us tonight, I think it's pretty clear that there's a very important role for preparing your body for pregnancy. And I think that there are few people as qualified as yourself in Melbourne to help women planning a pregnancy to do that. So for women who, after seeing you tonight, want to come and get your help or sort of access the services of Be Active, how can they do that? And what does Be Active sort of offer as a general sort of thing to all women looking for your care?
Okay, great. Thank you. So Be Active, essentially we are there to support all women in the childbearing years. That's our main focus. So preparation, pregnancy and postpartum. We have got a range of services like physiotherapy to get yourself ready or to get yourself best through your pregnancy. We've got fitness classes for pregnancy. So they are cardio strength related. We've got reformer classes, so Pilates style classes for pregnancy. We've also got a range of online options, which we've worked hard at through COVID. We've got Be Active at Home. So we've got a range of classes that you can do from the comfort of your own home. We also do telehealth. So if you're not local to Paran, so we're based in Melbourne. So if you're not local to Paran, we can do everything on via Zoom, which has been really effective and a great way to kind of service people wider. Yeah,
absolutely.
So lots of options, but I'm happy for people to kind of reach out, send me messages if you've got more specific questions as well through my page. So
excellent, fantastic. Sure. Well, obviously, as I say, the large number of women that I've sent in your direction have all found the care that they've been given during pregnancy just wonderful. None more than my wife, who was not my own patient, but she has absolutely loved being helped. And hopefully one day when we have another pregnancy, I am sure you will see her again.
Yes, looking forward to it.
Me too. I'm very grateful for all your time tonight. Thank you so much. And as I say, I can't recommend Be Active highly enough. So thanks for everything you do, and we'll be in touch soon.
Thanks so much, Scott. Thanks for having me, and thanks for all your
pleasure.
lives. I've learnt heaps from all of them. So thanks a lot.
Brilliant. Plenty more coming. Excellent. See you, Shira.
See you soon. Thanks.
Bye.
Bye-bye.
Bye.